Hi, my name is Max. I'm the winner of Dr. Linkov's hair transplant competition last February. I had my procedure in May 2023, and these are my results 10 months on.
So just give us a sense of your hair loss history, when it started, all that.
Sure. I think for as long as I can really remember, I've had pretty thin hair dating back to probably maybe the age of 15 or 16. I knew that I had kind of these high peaks is what I call them. However, in the last, I would say 3 to 4 years, I've definitely noticed a marked difference in what my hair looks like. So I've noticed more kind of diffuse thinning across the top of my head. I've noticed some recession in those peaks kind of that I was talking about, especially here in the front.
Have you tried any medical therapies for your hair loss?
I haven't, honestly. I haven't really made the leap. So at the time, I kind of shooed it away, and I wasn't really doing anything. I wasn't even really thinking, consciously about, hair loss, because it wasn't really progressing that much at that time anyways.
What would you say, Max, are your goals at this point?
Going through some kind of course of treatment, whether it just be, medication and or surgery. It's kind of part of, I guess, a larger, more holistic improvement of my health I'm looking to do.
Okay, let's take a closer look. Maybe just bring your chin down a little bit.
Okay.
So basically what I'm seeing is that the temples overall aren't bad, but the frontal scalp is rather weak. Mid scalp isn't bad. Crown is not too bad. Just mild loss there, but nothing that I would operate on as far as the crown goes. But I think the frontal scalp can use quite a bit of work. You know what I mean?
Yeah. Absolutely.
I would work the frontal scalp into the temple so that it kind of everything sort of fits together. In your case, you're 26. I think most of what I'm seeing is just, androgenic nail pattern loss. You're at that age when things can start to accelerate sometimes. They might be stable, but
right.
20s, early 30s, that's the worst time just for this process. Definitely, I would say if you're thinking about surgery, I would stabilize with medical therapy as well.
I'm certainly interested in that, absolutely.
I think it's worth trying because if we do a transplant, clearly medical therapy alone is not going to be enough. I think in your case, you'd really benefit from a solid procedure at the front here.
Absolutely. That's really the area that I'm most sort of cognizant of.
All right, Max, any other questions for me?
No, I don't think so presently. I'm excited to try out some of these medications and see how they work and see if this is the right thing with the whole process and everything. But I appreciate you guys taking the time.
Absolutely. Yeah. Thank you, Max. All the best.
Welcome to the first free hair transplant competition. Here we have 4 participants that will be taking part in today's challenge. So our first mini game is to take one of these balls and throw it into each of these targets.
Hi everyone, I'm Max. I'm 26. I'm a professional pilot. I live in White Plains, New York.
Okay, that's 1 point.
Oh god.
On. You know what that means.
I'm never letting go.
The second mini game is Jenga. That was really good. Max. All right, okay.
Oh, there wasn't much I could do there.
Yeah,
it's all right.
That was a tough one. Yeah. Please release your hand.
I haven't played Jenga in about 10 years, so that was a great way to get thrown back into it. But yeah, I feel more relaxed now for sure.
Okay,
Our chances are better than ever now. It's 1 out of 2.
1 out of 2, exactly. It's time for our last mini game. I'm gonna ask a question. The first to buzz gets to answer the question first. And if you get it right, you get 1 point. You get it wrong, you get -1. The person with the most points at the end of 5 questions wins the hair transplant. Last question, we'll see. Maybe Steve will tie it. Rounded to the nearest number, on average, how many hairs are in a graft? Steve, you buzzed in.
3.
That is incorrect. We have a winner. Okay. Congratulations, Max.
Thanks.
How do you feel?
I feel great.
You can officially release the hand as the winner.
I'm taking this home. I thought the competition was a lot of fun. I'm glad I studied up on Dr. Linkov's videos before I came here. It's an amazing feeling, especially knowing, you know, the monetary value of this transplant. It was something I was definitely planning on at some point, but now, you know, that I have the opportunity to have it soon and have it with Dr. Linkov is really, really awesome. I feel pretty excited to share the journey. I think that, you know, instead this is a new concept for Dr. Linkov on his channel, and I'm happy that I could be part of, you know, pioneering this kind of form of content. And I think it's definitely something that could be really important for prospective patients to see all aspects of the procedure, from the consult to the actual procedure, the recovery, and then the results.
Get ready for the new me.
So here we have the hairline, the neo hairline marked out, and we've moved the right temple forward. You can see with these markings here, the right temple has moved in to better match the left side. We have a nice natural curvature from the temple to the central hairline here, and this is called the frontotemporal area. This is called the anterior temple peak, and you can see how far back we've marked. We're going all the way back here with the transplants to better match the remaining hair around. You know, he's had great results with minoxidil finasteride. This was all much thinner, but still there's an area of thinness up here in the front. So we're gonna bolster that with grafts, and then you can see as we go to the left side, something similar. But again, this temple doesn't require much work to better match the right side. So just a little bit right here at the upper part of the left temple will nicely match this side. So you can see I've made these little dots, and these dots allow me to go in between to create irregularity. And so that there's going to be micro irregularity between the dots and macro irregularity where I have these little drop downs. So that's going to make me go off the beaten path even more and give it a very natural look. And you'll see we'll introduce some random grafts here and there to make it even more irregular and make it look more natural. The single hair grafts are going to go right here at the hairline, the frontal few rows, and then we're going to build heavier grafts in behind that. So that's the plan. So how's it going, Max?
It's all right. It was definitely a long time for all that extraction, sitting in some awkward positions, but that was kind of the worst of it. Once I was numb, didn't really have much pain, really no pain, just sort of the tedium of sitting still in a weird position for a while. But glad we are through that. I think the fun part probably.
Well, yeah, I mean, it's fun to get the hair back into the head where you want it.
Right.
Oh
my.
Oh yeah.
That's good density.
Yeah, man.
It's gonna look awesome.
It will. That's the spirit. How was the procedure, Max?
It was good, very long, definitely ready to get home and get in bed, but overall it was pretty good.
Are you glad you went through the competition?
Absolutely. I'm very happy to have had the procedure done here. I'm very grateful for it.
Anything that you'd like to tell people who are thinking of getting a hair transplant but they're just not sure?
Personally, I'll have to wait and see the results. I'm pretty confident that the results will be good, and I'll take very good care in my post-op to keep everything healing nicely. But just be mentally prepared, I guess, for a long day. Mostly no pain, just kind of having to sit still and be relaxed. So basically come with a good frame of mind.
How are you feeling today?
Feeling good. Definitely excited to be back here to see Dr. Linkov's new office and to kind of wrap up this process. I feel like it's been a long time, but at the same time, 10 months isn't that much. And a lot has changed, obviously, in the last 10 months. So it is nice to be back here.
How was your experience overall?
Experience overall, I would say, was very positive. I mean, the surgery itself, that was a long day. That probably required the most patience and relaxation trying to get my head in the right space because that was a really long day of surgery. But the recovery was, I thought, really straightforward overall. There weren't really many surprises actually because I had learned a lot from Dr. Linkov's content, from other content I had viewed online prior to my surgery. So I kind of knew what to expect for the initial recovery and kind of the general timeline from the surgery leading up to right now at 10 months post-op. At times it was tough to be patient and to wait for new hair to grow in, for that hair to get longer, to thicken, and to kind of blend in with the rest of my hair. So there were some periods where it was a little bit tough because I thought I was so close, yet so far because I was sort of counting the days, and in reality the hair growth takes longer than that. Obviously it's periods of months from kind of one phase to the next of the recovery. So that's a me issue though. I think overall all my recovery, all my hair growth has been pretty much in line with what is generally expected post-transplant.
What was the most unexpected part of the process for you?
I will say the most unexpected thing for me was my general appearance after the surgery with a buzzed head of hair, which I've really never had. You know, I don't think maybe I was mentally prepared as well for that, but my hair grew back relatively quickly. I had a few weeks at home off from work before I returned and everything had a chance to kind of grow in a little bit. So be prepared for that, I guess, if your transplant involves buzzing all your hair off.
Have you ever shaved your head?
No.
Oh my god, really?
Yeah, I've had it fairly short, but
looks great. Maybe no hair transplant, just the shave.
As far as the rest of the recovery process and most of the surgery day itself, other than sort of the pain of some of the anesthetic shots, it was pretty much as I expected. There weren't too many surprises.
Is there anything you wish you would have known beforehand?
I think the main thing that I wish I had known from the beginning, and this isn't just for the transplant, but this is sort of for the process of hair loss and hair restoration in general, is that prevention is really one of the strongest tools that any one person has against this whole process. I think that if I had paid more attention when my hair loss started to really progress in my early 20s in college, in the year or two afterwards, and started on medical therapy, I could have perhaps maintained my hair a little bit better prior to the transplant. I am still glad, however, that I did elect at some point to start the process of hair restoration with medical therapy and then ultimately with surgery, because it definitely, I think, makes things easier to get a good result the stronger your pre-existing hair is.
Are you happy that you went through with this process?
I'm thrilled to have gone through this process. I know I'm in a unique position as the winner of the contest that Dr. Linkov put on, so that I was able to have this amazing surgery with an amazing doctor and amazing team here in New York. But I think that no matter what the situation would have been, whether I had gone elsewhere or paid out of pocket for surgery, I think that it's something that is really worthwhile for me, knowing now what the results have done for me personally, having restored my hair to this point that I haven't seen it in such a long time. It's given me a newfound sense of confidence and just general level of content with my appearance.
What advice do you have for people considering a hair transplant?
I would say my best advice is, like Dr. Linkov says, do the medical therapies. Make sure that you are trying these non-surgical options, you know, to see if you get a level of hair restoration that you're happy with, you know, for a certain amount that can't be covered by existing medical therapies. I'd absolutely recommend a transplant. I'd recommend getting a consultation and learning a lot about the surgery. Obviously, there's a time commitment associated with it. The recovery process takes a long time, and you have to accept that you won't look normal or like maybe you did previously for several months until your hair grows back. But overall, I think that it's a well worthwhile procedure to have. I don't think it's a fix to everything. I don't think that really any cosmetic procedure would be. I'm still working on myself overall outside of my appearance. You know, it's not just my hair. So I think that it's not a one-stop shop solution for everything, but it can make a huge difference if hair loss is something that you feel meddles in your life and your psyche. Well, I had a very positive experience overall with Dr. Linkov and his team, so I would highly recommend for anyone here in the New York area or willing to travel to the New York area to see Dr. Linkov for a consult and consider choosing him for your hair transplant.